measures that we're putting in place and the social distancing measures are likely to be having some early effect. I should say at the outset that we are not Italy, we are not the United States, we are not Spain. We have one of the highest rates of testing per head of population in the world and one of the lowest positive test rates. So we think, unlike countries like, unfortunately, like Italy, Iran and even the US, that when they detected significant outbreaks, they probably had much larger outbreaks in the community that were undetected. We feel reasonably confident that we are detecting a significant majority of the cases in Australia. That means that we can get on top of cases when they're detected. There are 5,000 or more public health workers in our states and territory public health units. I would like to give them a huge shout out tonight. They're the people who are contact tracing within hours every contact of a positive case, asking them to isolate and protecting the community. If we can keep our numbers at a level where we can continue to contact trace, where people behave and isolate when they're asked to, we can really bring about good suppression. As the Prime Minister has said, we've had a somewhat slowing of the growth in the epidemiology curve, but it's not enough. We have to slow it further. We have to slow it further, and we have to stop the thing that's worrying us most, which is community transmission. That's transmission without known links to a known case. And that is of concern, particularly in Sydney and to a lesser extent in Melbourne and southeast Queensland. There are tiny pockets of it in other states. Those things do worry us because if you have outbreaks in the community, they can be much harder to detect, and so we've broadened the testing criteria in those areas to make sure that we can detect and bring under control. But because we are not sure that these measures that we put in place will take the sufficient effect to bring the slope of the curve right down, that's why these additional measures are recommended by the National Cabinet tonight. Essentially, all is being talked about is what we've been saying all week. We have to change the way we as people interact with each other. It's very simple. We need to all stay home unless we're going out to shop, to do personal exercise, to go to medical appointments, or to go to work or study if you cannot work from home. So anyone who doesn't need to be out of their home should be in the home. This is radical. And the vast majority of Australians have done the right thing in the last week. We've seen huge evidence of that, but we've also seen some very silly behaviour of people who haven't complied with that, particularly outdoors and sometimes indoors. And that's why we feel that it's really important that every Australian does the right thing, because for these interventions to take effect, the science shows that you need more than 90% of the population to be doing it all of the time. So please, continue to do what you're doing, continue to follow these rules, and hopefully these early signs of flattening will mean that we can keep going and getting a reduction in the rate of increase every day. Thanks, Prime Minister.